All right, if you're getting ready for the NCLEX, you already know that pediatric questions can be, well, they can be really tough. So over the next few minutes, we're going to show you how to ditch the endless memorization and actually start thinking like the exam wants you to, using a powerful clinical reasoning framework that's designed to help you crush this section.
Okay, let's really break this down because it's a huge deal. The NCLEX doesn't really care if you can just label a disorder. What it's really testing is your ability to see a crisis coming a mile away. You've got to make that mental shift. It's all about looking at the child, the actual patient, not just the name of their condition on a chart.
And listen, the stakes here are, well, they're as high as they get. We're talking about a child's life and, frankly, your career. The whole point of this exam is to see if you're a safe nurse. Being able to spot those sneaky, subtle signs of a sickle cell crisis or understand the brain damage risk in a baby with PKU, that's not just a nice to know. That is exactly where you either pass or fail.
So what does it all boil down to? It's this. The NCLEX rewards your clinical judgment, plain and simple. It's not about what you know, it's about what you do. What's your first move? What are you monitoring? And can you explain why? It's a test of action, 100%.
Okay, so let's jump right in. What we're about to do is give you a sneak peek of the exam coach's framework. It's a really structured way to look at these pediatric conditions so that when you see them on the exam, you're not guessing. You're answering with total confidence.
But first, let's talk about why PIDS is such a beast for so many people. What are the real stumbling blocks?
I mean, does any of this ring a bell? You're trying to remember if this sign goes with a blood disorder or a metabolic one. Or maybe you've memorized everything about a disease, but when the question asks for the #1 priority, you just freeze. Look, it happens all the time, and it's usually because we're so busy trying to memorize endless lists of facts instead of really getting the why behind the risk. And that is exactly where having a framework becomes a total game changer. It takes all those scattered facts and turns them into a system. Let's actually see it in action with a few classic NCLEX-type scenarios.
So let's start with two blood disorders that can get confusing: sickle cell and beta thalassemia. The key is to think about the core problem. For sickle cell, it's a clumping problem, right? Those hemoglobin S cells stick together, causing a massive traffic jam. That's your vaso-occlusive crisis with all that pain and fever. But for beta thalassemia, it's a production problem. The body just isn't making enough of what it needs, which leads to those more chronic issues like severe anemia and even changes to the bones. Seeing that fundamental difference is everything.
Okay, picture this. A kid with sickle cell comes in, they've got that awful leg pain, they've got a fever. You know it's a vaso-occlusive crisis. The cells are clumping up, blocking everything. So what's your first move? What are you going to do to fix that specific problem? And here's how the framework helps you think. Your first instinct might be just pain meds. And yes, that's important. But the real priority is to attack the root cause, that clumping. So #1, hydration, to make the blood less sticky and get things moving. Then oxygen, because those tissues are starving. Pain management is absolutely vital, but it's part of a bigger, life-saving strategy. See how that works?
Okay, let's switch gears to a coagulation issue, von Willebrand's disease. The core problem here is super simple. The platelets just aren't sticky enough. They can't clump together like they're supposed to when there's an injury. So, where do you think you're going to see the bleeding? Not deep inside, but in all those places with mucous membranes, like nosebleeds, bleeding gums, easy bruising. It's a straight line from the what's wrong to the what you see.
So, here we go again. You're on the floor, a kid comes in with a nosebleed that won't quit and bruises everywhere. What's the first thing that should pop into your head as a nurse? It's all about safety. Of course, you're going to assess the bleeding they have right now, but your brain has to jump immediately to preventing the next bleed. You're thinking, are they playing football? Does their family know what to look for? That kind of proactive, preventative mindset is exactly what the NCLEX is looking for. All right, now let's tackle a metabolic disorder, PKU. And with this one, the framework makes it so clear. On one side, you've got the problem. A poison, phenylalanine, is building up in the blood to toxic levels. And on the other side, the consequence, permanent, irreversible brain damage. That link between that one lab value and that devastating outcome, that's the whole story. And you will absolutely see this on the NCLEX. A newborn screening comes back positive for PKU. You have to understand the clock is now ticking. Every minute counts. So what is your single most critical must-do-now action?
You have to stop the damage, period. Every single feed with protein is basically adding more of that poison to their system. So the intervention has to be immediate and non-negotiable. Cut out the phenylalanine.
It's all about protecting that developing brain, and you have no time to waste. Okay, let's wrap up our examples with the congenital disorder like cleft lip and palate, which is all about procedural care. Think about it in two phases. Before the surgery, your #1 job is safe feeding. You're trying to get calories in without the baby aspirating. That's where you use things like special nipples in that ESSR method. But then, after surgery, your entire focus shifts. Now it's all about protecting that brand new suture line. You can't let anything mess it up. See how the framework forces you to think about priorities changing over time? So, back to that pre-op baby who's having a hard time eating. When you're using all those special techniques, what is the one big life-threatening risk you're actually trying to prevent?
It always comes back to airway, breathing, circulation, the ABCs. Yeah, we want the baby to get calories, but protecting their airway is priority 1, 2, and 3. Every single thing you do, the special nipple, sitting them up, burping them often, it's all designed for one primary purpose, to keep formula out of their lungs. That's the top priority, always.
Okay, so we've bounced from blood disorders to metabolic issues to congenital problems. Let's pull back for a second and look at the big picture, the one big idea that connects all of these.
Here it is. This is the secret sauce. It doesn't matter if it's a sickle cell crisis or a baby who just had surgery. You are always doing these 3 things. Step 1, spot the complication early. Step 2, pick the intervention that keeps them safe right now. And step 3, remember you're dealing with a kid and their family, so development and family care matter. That's it. That system will carry you through any PEDS question the NCLEX can throw at you.
And that brings us to the most important point of this entire preview. Just knowing a bunch of facts about pediatric diseases is not going to be enough. At Exam Coaches, we don't just teach you stuff, we train you. We train you to recognize complications before they spiral. We train you to choose the right priority action every single time. We train you to think and act with real NCLEX-level clinical judgment.
Look, what you've seen here today, this was just the preview. It's just a small taste of how this kind of structured thinking can completely change how you study. The full pediatric framework, the whole shebang covering everything you need to know, is waiting for you inside. So I'll just leave you with this. Are you ready to finally stop memorizing and start reasoning?